Neoplastic and congenital nervous system diseases in dogs and cats. The congenital brain diseases are hydrocephalus, lissencephaly, cerebellar hypoplasia, Chiari-like malformation, and syringomyelia. Congenital and acquired spinal cord diseases are Wobbler syndrome, atlantoaxial luxation, degenerative myelopathy, and fibrous cartilage embolism. This topic also has intervertebral disc disease, neoplastic diseases, and peripheral nervous system neoplasia. For hydrocephalus, it is ventricular dilation from increased cerebrospinal fluid. The types are communicating and non-communicating. Communicating is when the cerebrospinal fluid flow is intact. Non-communicating is when the cerebrospinal fluid flow is obstructed. The breeds affected are toy breeds, brachycephalics, and Persian cats. And the signs are skull deformity, seizures, blindness, and strabismus, which means cross-eyed. Lissencephaly is when the brain has a smooth appearance. This is due to the brain lacking gyri and sulci, and the breed disposed is the Lhasa apso. Clinical signs are learning difficulties. For cerebellar hypoplasia, it can be caused by feline panleukemia virus in cats or canine parvovirus in dogs. For Chiari-like malformation, this is when there's cerebellar herniation through the foramen magnum, and the breeds disposed are Cavalier King Charles. Syringomyelia is when there's a cavitation in the spinal cord. The signs are neuropathic pain, ataxia, and excessive scratching. Wobbler syndrome is when there's a cervical spinal compression, and the breeds disposed are Great Danes and Dobermans. And atlantoluxation is when there's a dorsal luxation of the C2, and toy breeds are predisposed. Signs are neck pain and ataxia. For degenerative myopathy, this is when there's a progressive, non-painful hind limb paresis in older dogs. For neoplastic diseases, the primary brain tumors in dogs are meningioma, glioma, and histiocytic sarcoma. In cats, it's also meningioma, but they have lymphoma and glioma as well. Signs are progressive dysfunction, ataxia, convulsions, and blindness. And for the treatment, you give radiotherapy for inoperable tumors and surgery for superficial tumors. For symptomatic care, you can give anticonvulsives and corticosteroids. Peripheral nervous system neoplasias are nerve sheath tumors and spinal cord tumors. For nerve sheath tumors, the signs are chronic lameness and pain, and the spinal cord tumors, if they're extradural, they can be hemangiosarcoma, fibrosarcoma, and osteosarcoma.